Good morning and welcome to our project, Teaming from the Start, a pilot program for team learning of technical skills and clinical reasoning involving physical therapy, occupational therapy, and nursing students. My name is Denise Bender, Program Director for the Doctor of Physical Therapy program. My colleagues on this project were Dr. Jessica Tsotsoros, Occupational Therapy faculty, Professor Loren Stein, Nursing faculty, and Dr. Sheri Wainscott, Nursing faculty. Our objectives are listed here. This picture won't surprise you. You know the campus, but what you may not know, as we did not know, is where all these buildings are located. While in Oklahoma City, we are next door to our College of Nursing, and they are next door, practically next door to the College of Allied Health. We hadn't been in each other's buildings. OT and PT students are also housed on our Tulsa campus. So we had a great deal of getting to know you to do before we could begin this program. So we started at the faculty level. We toured each other's physical spaces to see what we had in the way of classrooms and laboratories. Our goal was to find one on-campus space that allowed all of our students to come together. While we could disperse them across our buildings, we thought that the power of the activity would be more impactful if they were all in the same space and they could not only see themselves learning in small groups, but see the other small groups learning. We then pulled together our curricula to look at what courses the students took and where we had shared content. And this all occurred over a series of meetings. There were some barriers. To begin with, when you have three different professions, you have three different schedules. We were lucky in that the OT and the PT students were both involved in the same course, a 3-credit course of clinical skills. The nursing students had a separate course and it was a 4-credit course. So immediately we had differing amounts of time allotted to laboratory sessions and allotted to lecture time. So one of our first decisions was pull this class out of traditional times and put it in a freestanding time where we wouldn't be tied to existing schedules. The next thing we had to work with was the rotations. Entry-level nursing students are only on campus in the classroom for 4 weeks. Then they go into the clinics and do their hospital work. Our PT and OT students follow a traditional schedule, so they were available for all 16 weeks. We decided we would go with the nursing schedule as it was the more restrictive, so immediately our project had to happen within the first 4 weeks of school. Then we moved into considering accreditation. All of us had the same accreditation standards based on IPEC competency, but the wording and the expectation levels were a little bit different. And then finally, who had the power? It is not just the faculty in the classroom who usually has the ability to say, I'm plucking all of our students out and I'm putting them all together in a mandatory activity that's going to happen in what's usually unassigned times. That usually has to happen at the program director level or higher. So while I could manage that for our PT students as their program director, we had to bring in other leadership to help us make this plan. What was interesting with this project and why we picked these students deliberately was they are at 3 different degree levels. The nurses are at the baccalaureate level, the OT students are at the master's level, and the PT students at the doctorate level. What we wanted them to understand is when you are a team, the educational level is not the issue. It's the preparation and it's what the patient needs. So we picked a skill they all shared in common, assessing vital signs and patient education. And we gave them this experience of working together. Now, another problem we had was there were so many more nursing students than there were PT and OT students. But since the PT and OT students spend many of their classes together in their first year, they already had a familiarity with each other. Those students had already been here. They had spent a summer taking anatomy together. The nursing students were brand new on campus and hadn't been there at all. So while our numbers were different, we thought when you put the PT and OT together, they compared reasonably well to the numbers of nurses. We then went into the accreditation standards to look at exactly what was required and how well this would meet it, because none of us wanted to do an IPE project as a pilot with the goal for expanding it in the future if it wasn't going to fully meet all of our standards. And we found that it did. And we found that using technical skills worked nicely because it's an easily measurable activity. We looked at our Bloom's level. While these were novice learners, vital signs is a skill that you must learn at least the intermediate level so that you're able to take it and practice it in your clinic or your hospital rotations. So we set intermediate levels. We decided the IPEC competencies that worked best were teams and teamwork, roles and responsibilities, and communication. We quickly realized with this number of students, the 4 of us could not manage all of them if we were going to try for the same time block, so we each took responsibility for bringing in more OT, PT, and nursing faculty. And then finally, we had to settle on a time and a date. Student buy-in, always the issue. Now, I admit that we helped ourselves by going after novice learners early in their career. The first couple of weeks of school, students are almost up for any activity. They don't know what to expect. It all sounds exciting and it all sounds doable. However, students are very quickly coming into contact with upper class students who will tell them, we didn't do that and we were just fine. You don't need that, you'll learn that in classes. What can you learn from a different discipline about that you won't already know? So what we did was create some PowerPoint slides to show them, to talk about what the IPEC competencies were and why they were important. We talked about All Professions Day, a mandatory activity that was coming later in the semester. Talked about 1,400 students, and wouldn't it be nice to walk into that activity already knowing a few students from another profession, which they all agreed it would. And then finally, we talked about how quickly they would all end up on their clinical and hospital rotations. And wouldn't it be helpful to walk into a rotation, not just knowing what you knew about vital signs, but knowing a little bit about what the other professions knew as well. This took a great deal of pre-work because there were so many students. We started in our individual classrooms. We wanted the students, because they were at 3 different degree levels, to feel equally competent. So we made sure that every student had been taught and given some sort of a checkout on their skills at assessing pulse, blood pressure, and respiration. We then took the students and randomly divided them into teams of 8 to 10 students with a faculty facilitator. Because the faculty in nursing had just met their students, they also didn't know them. So we gave everyone a different shirt color. That way, any faculty member could easily identify who in my group is PT, OT, or nursing. It also helped the students who didn't know each other all that well to also pick out their colleagues and people from the other professions. We had to create maps because we realized even walking 2 or 3 buildings down on campus can hopelessly disorient people should they go the wrong way. So we created all of the handouts for the maps. We labeled all of the small group areas. We put name tags on the faculty, and then we created a 1-page handout, easy to hold on to, easy to know when you were done. You did the first side, you did the second side, and then you were done. And we put all faculty members who were helping us onto our D2L courses so that they could jump in, review the handout ahead of time, look over the whole course that we were pulling students from if they wanted to. All of these materials were gathered in advance. We had emails of the students, which was really nice that we were using our own students. So that made it very quick to send group emails. And the handout, we tried to mirror what would happen later in All Professions Day, so that when they got to that second activity, they could say, oh, I know why this is important. I already know what competency this is tied to. So we started with a round robin where they looked at these questions. Remember, the nursing students had only been in nursing program for a couple of weeks. So they knew very little about the role of nurse compared to the PT and OT students who had been in class for a semester and had their own course on concepts of rehabilitation. So we wanted to write questions that allowed all of the students to have something to say, regardless of where they were in their professional development. After the round robin, they moved into teams and teamwork. Now remember, they had all learned their skills. So they were all in a position to give each other feedback and offer tips. In my lab, we learned to do it this way. In my part-time job, which is related to the profession that I do, I've learned this tip, or I've learned this way of making it faster or easier. So they practiced the skills, and they practiced giving each other the type of feedback they would give a patient based on what they found when they took the vital signs. Then they had been instructed to bring some sort of a tablet or a computer, which all students have. They viewed 2 patient education videos, both related to commercial products you might use to instruct a patient and a family on hypertension. And as a team, they had to decide which one their team would recommend. And they were encouraged to speak up from a nursing perspective, what was important to be in the video, from a PT and OT perspective, what areas were important to them. After they worked on that together and came to a consensus after debating and discussing, they then each answered the reflection question. What did you learn today that you didn't know before? So this was all our pre-planning of what would happen on the day of activity. It was controlled chaos, I like to call it. Because nursing building has an open floor plan, we settled on the nursing building for our site. We could have some people in the open floor plan in the foyer. We had hallways off the side we could put people, and classrooms that opened off those hallways. So all students were within the same large geographic area, but we could separate them out into their groups. We had posted signage about noise, but we'll talk more about that later. And as you can see, the students were able to get to work. It was very active, it was very engaging. They all had something to do and things to talk about. Well, we learned a few lessons. It was unbelievably loud. Loudest in the central hallways, less loud as we got into the classroom, but still, it was loud, and we noticed many students needed to sort of huddle together to be able to hear. On one hand, that's good. We want the group to come and be cohesive. But on the other hand, should we have a student with any sort of a hearing issue, that would not have worked. We should have done more than post signs that day that it was going to be loud. We heard nursing was very gracious to us, but I'm sure we interrupted a few meetings that could have been rescheduled or moved elsewhere had they known how loud we would be. We found that we had more faculty than we needed. We were mostly walking and watching with a very clear handout. These are professional level students. They could facilitate themselves. They worked straight through it. They knew what to do. They knew when they were done with a section. They knew the objective they were to reach. And it really helped to talk to them ahead of time about what they were going to do and what they were going to get out of it, because they all jumped in. It went really well. Student participation was really high. We saw lots of smiles. We heard, as we got to the end of the session, lots of sidebar conversations, which were okay. They were learning about each other as people as well as professionals. They all indicated that all 3 IPAC competencies had been met, and the reflection all said they showed value. 4 weeks later, I heard from some of my students that they had seen some of their nursing and OT partners in their all professions group, or they saw them in the same room. And while they didn't know each other, there was that sense of awareness of, I know who you are, I know a little bit about what you do. Their reflections went beyond I had a good time to show some aha moments. Not only did they gather more depth about what other people did, but they gathered more depth in what they did, or they realized, I know what I do, but I've never thought about how to explain it to someone else. They realized there are differences in the professions, that everybody takes very different roads to end up as part of that team. This project and many other projects could not happen without the strong support that exists for IPE on our campus. Every individual college is equally embedded in the idea of students learning to work together and to become a team so that they will be effective teams when they graduate. The willingness of the faculty to modify schedules, to make their students available, to talk this program up, and to bring in fellow colleagues to help us manage the numbers of students was outstanding. If you are interested in building into this project with us, helping us expand it, or to doing any other IP projects we have on campus, here are our contact numbers. Please reach out to us and let us know that you too value interprofessional education and would like to make your students become a part of it. Thank you.